Okay, awesome work. And Catherine, you just have to help me keep an eye on people still entering the workshop and the chat as well. All right, so we're going to be talking about grief, compassion, fatigue, and burnout in this workshop. And I'm just going to put a little bit of a trigger warning out there as well. So just some of the stuff it might bring up, it will probably bring up quite a few emotions for you. And my understanding is that you would have talked about this, I think, in the past. But yeah, just so you know, it could get a little bit emotional at times. And if you do need to, take a bit of a rest or come back to the workshop at any time, that's absolutely understandable. And just I encourage you to do what you need to do in that situation. Okay. So the aims of this workshop today, we're not going to be teaching about grief, so to speak, but we want to be sort of guides and facilitators to help you explore the impacts of death, dying and grief on you in this profession, how and why the impacts of grief and loss can turn into compassion, fatigue and burnout, and how can we actually develop ways of managing this and therefore our well-being within the veterinary profession. So we're going to start by getting into breakout rooms, and we're going to be talking about these two questions here. So the first one is, how do you feel about the prospect of not being able to save all of your patients? And the second question being, how can understanding grief and managing your own response to grief help you as vets? So we've got 10 minutes now to discuss this in the breakout rooms. And just looking at our participant list, my colleague Catherine is going to help organise all of us into breakout rooms. And when you do go into the breakout rooms, it would be really nice to, perhaps turn your video on and, definitely share as much as you feel comfortable with. I'm just going to post these two questions in the chat as well. Looks like most people have joined the breakout rooms, eh?
Almost, yeah. There we go.
Good.
Okay, do you have a timer on? I don't have my phone with me, but I can time it on.
Made a mental note that we started at 1:05.
Okay.
So we'll bring them back at 15 past.
Good one. Yeah, there's no one in the waiting room, so that's good.
Oh, that's good.
Did you want to pause the recording? I'll pause it.
That you guys talked about from that discussion. And ideally you'll have 2 or 3 people from different groups.
Is anyone willing to share the themes of their discussions?
We kind of discussed that, there can be a lot of tough situations, like whether it be neglect or terminal disease, or even if it's just someone can't pay for a treatment, that, in those situations, death isn't always the worst option. sometimes going home to a family that can't look after them or trying to prolong treatment can actually be worse than euthanasia.
Yeah, it's a really good point. Yeah, thank you, Kiana.
For me, the main thing that I've found in the past is not so much that I can't save them all. It's when you have that run of deaths where everything just seems to die on you. If it happens one at a time, once a week maybe, then you can kind of deal with it. But when you've got multiple in a week or in a day, I find that really hard because you don't have time to sort of mourn that one that you've lost. You've got to sort of mourn them all at the same time.
Yeah, that's a really good point, Katie, and not much time to process what's going on, eh? Just having to keep on going, and that can be really tough.
Yeah, Katie, that's a good point. There's a cumulative response there then, isn't there? There's a cumulative buildup, which has its own set of issues. And in response to Kiana, it's the same thing there. The grief of sending them home or the grief of euthanizing, they each have their own complicated sort of outcomes that can contribute to our grief response. Good examples. Anyone else?
One thing I do know is that all grief is different. All cases affect you in different ways, and your sorry, it'll take me a few seconds to find the words. Your mental state at the time, so your hydration levels, your stress levels, your fatigue levels, your hunger, what has happened in the past day, what's happened in the past week, what's happening in your life currently. These all impact how you respond to that grief. And if there's a case that, as Megan pointed out, I think it was Megan, sorry, I didn't catch your name.
Yeah, we were in the group. Yeah.
If there's a case that ties back to a past experience that was really personal to you, that's going to hit you a lot harder than a case that doesn't have any ties. So there's a lot of your own internal environment that affects your grief as well.
Yeah, I think that's a really good point, Jan, about the context and what's going on for you personally. That's definitely going to have an impact on your response. There can't be enough said for that, for sure.
And all of those factors play a part in self-care and also our ability to bounce back from those situations as well, and playing a part of our resilience.
Some great discussions there, everyone. Some really good discussions were had in those breakout rooms. I can tell that was really good.
Awesome. We'll move on.
Okay, so we've come to follow on from, segue in here. We've just had some group discussion. We're going to carry on having a group discussion now, and so I'll look for you to share in this large group. One of the hardest parts of being a vet and a human is witnessing coping with suffering, death, and dying. So how can suffering and/or death affect clients? What do you notice?
Very overwhelmed.
Yeah.
Either emotional, aggressional. Aggressive. They can get very aggressive, start crying, start rolling on the ground. They can just get a bit odd about it, really.
Yeah. So we can see people who are having a acute response and no filter on their emotions. So it's raw, right? So you explained it really well there, Taz, and that can get really vulnerable. They, very, very quickly escalate because there's just no filter on that fight or flight or freeze response, and it can get pretty messy. Anyone else? How can suffering and or death affect our clients? How have we seen this? Megan?
I was just thinking you can get, I know we've talked about this bit with Stuart, but you can get such a range of responses that I think as a vet, it's good to be mindful of all of them, like we talked about with anger and sadness, but you can also have people who are very, when you'd expect there to be those things, they can be quite, they act as if they don't care, or they laugh about it, or they play it off as another way of dealing with that, or being in denial of, or having one of those particular stages of grief. And I think as a vet, that might be, or at least as new grads, when we were going through those scenarios, in my head, it would be quite shocking, or I felt quite shocked by it. But as it's kind of our job to be mindful that they are going through a process and not come off as being judgmental in those moments.
Good point, Megan. It can be untypical. It can be a response that we're not expecting, and that can throw us for a loop. And we all deal with crises and suffering differently. And so someone who's shut down or avoidant or freezing in their response may be confronting to us, but we see it and we have to manage it. But we do see that in clients, that you expect that they're going to have some sort of tearful or anger response, and yet they shut down or are in denial. It's very, not so uncommon, for sure. How can it affect vets, interns, and staff then?
Hi. When we were talking in the group before, I mentioned that like I get kind of teary even if the actual situation hasn't affected me that much, just because like if somebody else is upset, I guess that could affect the clients as well.
Yep, absolutely, Lee.
And
thank you for sharing.
I've also seen some vets that can get irritated by like what they perceive as an over-the-top response to death, which I don't think is really fair.
Right. It's such an important point, Lee, is that other people's emotions can affect us. And I know a lot of people with compassion and depth of empathy really will feel tearful when a client is tearful. And then how does that then impact their response? Does your connection co-regulate them? Does that make them feel like it's more of a human response, or does it make them feel like they have less trust in that relationship? There's all sorts of reactions and responses in that situation. Hey. Great discussion.
For vets and interns as well, I think you can also get a bit frustrated with the owners. I've personally had owners who are just so overwhelmed and by what's going on that they can't make a decision. And with the knowledge that we have, we know how, if it's really time critical, how fast that decision really needs to be made, and the owners just aren't there, emotionally or mentally to make that decision. And I personally find that really frustrating, because I just want to shake them saying, I know you're upset, but we need to do something. We need to do it soon.
Yeah.
Yeah.
So their lack of ability to respond timely in those critical moments affects your overwhelm, and it affects your capacity to do your job. And I suppose that is going to trigger frustration. So it can trigger frustration. It can trigger empathy. And often those things are projected by your clients. And so when they're projected to you, you got to wonder, is their anger making me angry? Or is their sadness making me sad? What's my response apart from them? So much to deal with, hey. How might the above impact your decision making? That's a segue, Katie, a segue into the last question. How might the above impact your decision making as a vet? What do you do?
I think it can mean that the vet kind of takes over a little bit more of the decision making of the client, which probably isn't the best, but or you have to sort of break it down a lot easier for the client, or getting someone else in to help the client make the decision. I don't know if I'm just rambling here, but yeah.
Very good. No, very good, Katie. I mean, you either have to make the decision or you have to scaffold it for them, in summary to what you said, or you have to get someone in who's calm and objective and can be a presence of a different sort of energy in the room. Those are really good examples. Yes, that's very good. Because it is going to impact your decision making. Their experience and their response and their projection of what's going on for them is going to affect you. So where do we go with that? And we'll get into this a little bit more. Does anyone want to contribute anything further on that last one?
I was just going to say that if they are kind of projecting a high level of attachment or disattachment, that can kind of impact what we want to do as well. So if they are showing they've had this dog for 15 years and they die without them, it would make you want to do as much as you possibly can to save them. Whereas if someone's like, oh, this is my dog, that's about it. They live in my backyard. It might not drive you as much to really try to save them, like kind of with animal welfare things in mind.
Yeah. Can anyone kind of relate to that? I hear what you're saying, Kiana, is that the response of your client may impact, how invested you are in that situation. And that's a natural human response.
To add on a little bit to that one in terms of client response, I think it's slightly different in terms of not what exactly they're saying, in terms of their connection with the animal, but even just their emotional response can influence your decision making. In the fact, for example, if you do have someone who is very upset and you are feeling that empathy and you are, I know that can be a motivation to do the absolute best that you can to save this animal. Whereas, if you have someone who is very angry at you, who is irate with you, who is scaring you, I feel like that can impact decision making because you want the interaction to be over as quickly. At least personally, if I have someone yelling at me, I would still want to do best practice, but I would want to do something as quickly as possible. Whereas if I had a client who was, visibly distressed and crying, and I think it would be easier for me to have the empathy and to take more time with them, to wait for them to be with them whilst they calm down, or to come up with a plan and have that kind of time. I think it's that sort of emotional response that you have to someone else being emotional with you, but it depends on their specific reaction.
What great conversation, and thank you so much for your vulnerability in that, in those points, because it is really, really imperative for you to have that insight. What is driving me to make this decision? If this person was calm, would that make me make a different decision? Because like you said, Megan, it's so important to practice best practice and to give everyone a similar attention and treatment, right? So this is why this discussion is so important, so that we can learn how to remain neutral and make decisions based on facts and what's in front of you rather than the emotional response. Hard to do. It's just a comment in the chat. Jen, I'm so glad I'm not alone with the immediate waterworks. Yeah, definitely not. You're in this profession for a reason, right? And along with that comes empathy and compassion. So yeah, thank you very much for your contributions, everyone.
Awesome. Some wonderful discussion there, guys. That's awesome. Okay. So I'm just going to ask you to reflect for a moment, and we're going to think about how we've noticed grief presenting in people that we know. So you might have seen it in your personal life, or perhaps in a placement or in practice somewhere. I just want you to take just a couple of minutes and think about how you've noticed grief presenting physically, emotionally, socially, psychologically, and spiritually. And some of this we've already been discussing over the last first part of the session so far. I'm just going to ask a couple of people to share their reflections if you feel comfortable.
I have a friend that's in her second year of working, and I think everyone that knows her has definitely realized that while she's gained all these incredible skills as a vet, definitely she's coming across as being very fatigued all the time, and just like not wanting to do stuff that you'd normally want to do, and just feeling really exhausted and not being able to do the things that you used to love doing. Yeah, sorry, I don't know what else I was going to say.
Thank you for sharing, Shoshana. Is that how I pronounce your name?
Yeah, Shoshana.
Shoshana, yeah, thank you for sharing, and that's really interesting that you've been able to notice these things as sort of a friend, and and I guess it would be interesting, I guess from her perspective, if she sort of agrees with these things, or if she's also experienced that shift since she's gone into practice. It is one of those professions that is very taxing and very draining, and that's why we're going to spend some of this workshop talking about self-care and how we can put some practices in place to be able to do things for ourselves so that we can bounce back to our baseline level as quickly as possible after we're exposed to stressors in our workplace. Anyone else want to share their reflection?
Just in the chat here, I had a friend complain about a new doctor working. She was being demanding in surgery and overbearing, not wanting music played in surgery like normal. Turns out she'd had lost a patient at another clinic. That's a really good reflection, a really good example. When you notice changes in people that are, you can tell it's out of character. It tells you that there's some sort of response going on there. And yes, if you tie this one together, the patient had lost, the clinician had lost a patient in another clinic. And so we recognize these things. We recognize these things in each other. We don't always recognize them in ourselves. I think the reason, a really good reason Em wanted us to take the moment to reflect for a moment here is so that you can understand that we can recognize this in others, and it's also important to recognize it in ourselves. And therefore, what do we do? Is it important to recognize these things?
Absolutely, yeah. And I guess, we will see grief being presented in many different ways, and it will differ for each person. And these are just some of the things that we might notice. So it could be the colleague who stopped coming out for drinks a few months ago after they lost a loved one, or it's the classmate who seems to be getting sick a lot more often. It might be a client who is sobbing and wailing, or someone else who is furious at the care provided for their animal who didn't survive. It might be a friend who seems quiet, and you remember it was about a year ago that they lost their family member. So yeah, it's just, I guess, really important to keep in mind that, yeah, there's many different ways that grief can be presented. And I'm now going to just going to be talking about the grief cycle. So I'll hand back over to you, Catherine. Just slide.
So I think some of you, thanks, Em. I think some of you have referred to the grief cycle, and the grief cycle, here we're going to just talk briefly about the grief cycle so that we can help you to recognize these things in yourself and others. A lot of us know bits and pieces about the grief cycle. It's a handy cycle to know about when you're in a helping profession. And so the key things that I'm going to talk about are just our 5 stages in this grief cycle. And the first one is denial. So after a major crisis, a loss, death, suffering, we can quickly go into denial. And this is a survival strategy, and it's there for a reason, right? Typically, we follow this cycle, and once I go through it, you might recognize it in that example that you gave, Shoshana, or the example that was in the chat. Denial helps us survive. It helps us to pretend that the actual thing didn't happen, okay? And this doesn't just have to be after a significant loss or crisis. It can be after a series of cumulative events. So cumulative adverse events. Denial helps us to get on with things. And it helps us to, just pretend that things didn't happen, that, we can just get on now because the hard thing didn't happen. It helps us to disconnect from our feelings, which are really hard to manage. And so denial is a survival strategy. And typically we will go through this when we experience grief, loss, compassion fatigue, so forth. The next one that I'm going to talk about is anger, because we can quickly go from denial into anger. And the reason for this is because in denial, we suppress our feelings so that we can just pretend it didn't happen and we can move on. But we know that suppressing our feelings for too long is not going to work. And this is a very evidence-based cycle. It is quite a typical thing. So we go into anger as a means of expression. So the loss was really hard and it sucked and it was really, really tragic and hard. And we didn't express, sometimes we don't express that in the denial stage. So we move on to anger as a way, as an outlet, a pathway to release those feelings, those big, uncomfortable feelings. And the problem with this is that it's healthy on one hand to express our feelings, but it becomes unhealthy because it can make us antisocial. It can make us unapproachable. It can make us hard to work with and hard to be around. And so that can lead to things like bargaining, for instance. So we can move from anger into bargaining. And I just want to preface this and say there's no timeline on this. So it's not like you'll be in denial for a week, yet predictable, and anger will be 3 days, yet predictable. It's going to be fluid and it's going to ebb and flow in between these stages, back and forth. So from anger, we go into bargaining. If only I could have done something differently. We sometimes search to a higher power, whether that be universe or God or whoever or whatever. But oftentimes in bargaining, we reach really hard into that place of, I will do anything. If I could just do this, and I will make it all go away. And that's the bargaining stage. So it gives us a kind of perceived sense of control. A little bit, it gives us a perceived sense, and perceived is the key word there, because bargaining then, once we realize our pleas and our bargains don't work, we can move into depression. And this is where our imagination slows down, reality sets in, and we feel the loss quite a lot more deeply. This is unavoidable. We're going to feel the depth of this at some point. We retreat, we become less social, and we start reaching out less. So you'll notice this in the grief cycle in others that you know, if you can reflect now and look at, oh, okay, yeah, that makes sense. And from depression, we can if we can move through this in a healthy way, and we can get some support and some counseling, if we can get some supervision, we can move into acceptance. And this is where we'll no longer resist the reality. We can accept that this is a sad situation, and it still exists, but it's it doesn't stress you out so much anymore. So when we go into acceptance, the situation is still sad, but it doesn't consume us. It's not taking over our relationships. It's not impacting our work so much. It's still sad, but we can accept that sadness and carry it on through wherever we go and whatever we do. So the grief cycle is really important to know about, so that you can recognize this if this is happening for you or for someone else, and that you can get the help you need, and that, or you can just process these things and recognize, oh, okay, this is actually normal. I'm not going crazy, or nothing wrong with me. I'm actually having a grief response here. And you can oscillate in between these. So just because you've gone to acceptance doesn't mean you can't go back to anger. You can. You can go back and you can go forward on this trajectory several times, and likely you will. As long as you know about it, you've got insight and awareness in how to recognize it and do something about it. Reach out.
Awesome. Thank you, Catherine. That was great. And yeah, it's a really fascinating cycle. And is it true, Catherine, that you can go sort of from, say, bargaining back into guilt and then back down again? It's not like a linear process necessarily, is it?
Yeah, like I said, you can go back and forth on this trajectory throughout, the loss that you're experiencing acutely, or through another loss. And you can go, like you mentioned, the guilt. And the guilt is something we often feel like, oh, I could have done this, I could have done that differently. And we shame ourselves and guilt ourselves. We can go into that quite quickly. And so it's really important to have these self-care strategies, but emotional support, your supervision, your friendships, your peers, your colleagues, to talk about these stages, because they are going to be relevant for you and for them. And talking about it doesn't just normalize it for you, it normalizes it for your colleagues as well. And I think that's where we really need to go, is be vulnerable enough to be able to talk and share, so that you can process these things, tie the loop, and move on from the loss, so it doesn't impact you so deeply.
Awesome. Okay, so from there we're going to now segue into watching two segments from Sarah Hogan, who has done a TED talk called The Emotional Cost of Euthanasia. Has anyone seen this before? Just raise your hand if you have. I'm just curious. Okay, doesn't look like you have. That's good. I was thinking maybe this has already been covered somewhere in your content. But essentially, yeah, we're going to be looking at some clips, and she introduces her experience and some important ideas. So I'm just going to load this up. Oh. Okay.
Sorry, Em, I don't know about anyone else, but the sound for that video isn't coming through.
Oh, okay.
It's quite muffled, yeah. Well, we can't really hear it. What can we do there?
If I just turn the volume up, I'll try again. Is there anything?
No, it's all jumpy. I'm wondering if you actually just put the link in the chat and we can all click on it and watch it on our computers.
That's a great idea. Yeah.
Good idea, Katie.
I haven't done this before in a workshop, so sorry about this. Okay. Okay, so I've just posted the link in the chat. So we're just going to be watching 5 minutes 55. So just, yeah. I'll just keep an eye on the time. To take one of these fees and think about this in relation to experiences that you've seen in practice. So it might have been, you know, the thoughts that go through your mind, I wish I had, the emotions that might come with those thoughts. So it could potentially be something like guilt or anxiety, and the sensations that the body has experienced. So it might be a knot in your stomach or a tense jaw, and the behaviours that these things can lead to, such as disconnecting and withdrawing, as we've seen discussed in the grief cycle. So just going to give you a few minutes to have a reflection here. It's enough time to have that reflection, and I think we'll just keep going on to the next part now, and I'm going to hand over to you, Catherine.
Right, thank you, Em. So this is when it goes next level. Okay, I'm going to talk a little bit about the more complicated sides of grief, compassion, fatigue, and burnout. And so we've just been thinking about some of the costs and, you know, paying the fee, turning, and how this can turn next level and be at risk of turning into compassion, fatigue, and burnout. So the three things that are coming up in this complicated process is disenfranchised grief, complicated grief, and trauma. I think a really big one, though, and it's common but not talked about, is disenfranchised grief. And disenfranchised grief is the grief that's not socially sanctioned. So it's not recognized by society that there is a loss. So it's a lack of recognition of the relationship with the loss, the lack of relationship of the loss, or the lack of recognition of the loss, and the lack of recognition of the person grieving. And so disenfranchised grief can become quite complicated. Society determines what the rules are of grieving, okay? And so it determines also who can grieve and how we respond to others. And so when society determines these things and the loss that we're grieving isn't validated or recognized, it can become complicated. So some examples of this are like the death of a partner after an affair, a miscarriage or termination of pregnancy, and the loss of a pet, especially very small animals, fish and birds. These things aren't socially sanctioned as acceptable to grieve. It may be acceptable, but there's no ritual around it. There's no recognition of it. This may also apply to large animals, like on a farm, where prevailing social discourses tend to discourage what may be perceived as sentimentality. And likewise in conservation with wildlife, where no one else may be available to care or share a tragedy. So vets may be affected by large numbers of animal death, where that is in a small animal clinic or euthanizing a herd of cows. Vets working with conservation and wildlife may experience preventable deaths as a result of something like resourcing issues, political attitudes, and towards the situation, and climate change. So in disenfranchised grief, there's an absence of grieving supports, no ceremony, no funeral, no rituals, no traditions, customs, which are socially sanctioned and needed to support the grieving process. So people experiencing disenfranchised grief feel their experience, if acknowledged at all, is minimized, and they feel isolated and unsupported. And this can lead to complicated grief and delays in recovery. So disenfranchised grief can lead to this complicated grief, and it can become it can happen after a series of this and a buildup of grief, and that can become complicated because it's none of the death that or the loss that you've experienced is socially sanctioned or has been mourned or have had supervision about or have had collegial or institutional support about. And also, exposure to traumatic events can lead to symptoms of compassion fatigue and burnout in clinicians. This, again, can be a single event or it can be cumulative. And secondary trauma is also something to consider as a vet. And we've talked about this and touched on it, in that your client's grief and loss may trigger you and a response in you. And so seeing people who are traumatized day in and day out by the loss of their pets or the injury or the crisis has a vicarious effect on us. And so it's really important to be aware of disenfranchised grief and the impacts it has that can lead to complicated grief. And it's also very important for you to recognize that a single traumatic event can cause complications in the grieving process or can cause trauma, or a series of cumulative events. It doesn't have to be one or the other. Cumulative stress and cumulative events can lead to the eventual compassion fatigue and burnout that we're talking about today. And that's when it goes next level. It's really important to talk about the fact that with something like disenfranchised grief, we need to do something about this in our professions. We need to combat this, and we can combat it if we seek healthy and appropriate support, if we have regular and adequate supervision, if we have organizational and collegial support that's available and that encourage us to process and debrief the situation, we can prevent complicated grief and a trauma response from happening, compassion fatigue and burnout. Conversations about your grief and the consequences of euthanasia, for instance, need to be held widely, because if they don't, that grief cycle will continue to be reinforced, and we will quickly go from, the end where we're coming out of it, acceptance, back to anger, back to guilt, back to denial and repression of these things. So it's really important to be aware that we have some impact on this disenfranchised grief, and sanctioning conversations about this can combat the outcomes of what it leads to. All right, Em, back to you.
Okay, thank you. It was really good discussion, and it's good to sort of talk about those things separately, but also recognize that they can happen together potentially as well. So yeah, good to get that initial understanding. So we're now going to look at how we can help our clients. So we've already talked a little bit about what might be experienced in terms of a grief response, what sort of things that you might visibly see when they're going through grief. So some of these things you might like to take on board for yourself, as well as sort of helping clients in the future. So reflective practice being one of them. So what we sort of mean by that is encouraging the client to reflect on, what has happened, and to tune into, it's so sort of validating, like what they've gone on, and the emotions that they're experiencing are indeed valid. Because as we talked about earlier, grief will present in different ways for different people, and all of those responses are valid. Self-awareness is a really important tool to have. So being self-aware, we can sort of know what our triggers are and how we might respond to stress when we go into that fight or flight mode. Empathy, being empathetic will really go a long way as well. So when we talk about empathy, that is about how we can put ourselves in the other person's shoes. And I'm sure, you are going through this with the client as well. So it's I guess you'll probably be feeling empathy for the client in that sense. It's really important to remain calm and sort of be like their support person, or like the rock at that point in time. And obviously things like death and dying, like it's important that the client can then seek out professional assistance, to help them through this time. But you will probably be that first person or that first point of call there for them, as someone who is calm. Following the client's lead. I guess essentially you are working as a team here on the situation, but as we talked about earlier, their ability to make decisions might be impacted. But I guess it's about looking at what that client needs at that point in time. Does decisions need to be sort of broken down and sort of scaffolded for them in order to think more clearly and to be able to get through in this time? Making time and space, which is probably easier said than done when you've probably got a busy day of other sort of clients that you are seeing. And but I guess if there's a way for the client to have time and space in the practice, or if there's like a somewhere where they can sit down and just take a moment to digest and process what's going on, it can be quite useful. Cultural awareness is something to be mindful of as well. So depending on the cultural background that the client is coming from, or they might experience, they might process grief differently perhaps, and it's just important to be aware of that, and in certain sort of procedures, or something that is done when there's a death. Learning about grief to provide normalizing, absolutely. So this is one of the opportunities where you will be learning about this and able to sort of, I guess, normalize this kind of stuff. Because I guess for a client, like if they have a death of their pet, like that's going to be a really, really stressful situation that's going to impact them pretty hard in most cases, I'm sure. Validating can be a really good tool as well. So saying things like, of course you will feel like this. So sort of validating what they are experiencing, as we talked about earlier as well. And reflecting is another really good technique to be able to show empathy. So it is a terrible shock, kind of reflecting on the situation, what is going on. reminding them to breathe. Yeah, so yeah, some of these things may or may not be appropriate, I guess, but they're just some ideas to sort of help. And yeah, asking who might be able to support that person at that time. Do they have a support network? Because yeah, I guess in this situation you can only do so much at the end of the day. So yeah, it's important that they have someone or a support network that they can rely upon, and team support as well. So yeah, maybe talking about these situations with your colleagues, and sharing on what you did as a vet, and also asking your colleagues if they've been through similar situations, or gathering advice of things that you might do differently next time, and what you did well in that particular situation as well.
Just a second, going back, thanks Anne for all of that. And I think going back to matching and pacing. So Dr. Dan Siegel talks about mirror neurons, and mirror neurons are quite the phenomenon. So when you're in a relationship with someone, no matter how brief or how long it's been, matching their tone and their body language can really de-escalate the situation. So if you notice that someone's talking quite slow and you notice that they're really dropped down, you can do that too, dropping your shoulders down, dropping your body down, and matching their tone, matching their pace. And if someone's really riled up and angry, and I can't believe you let this happen, you can say, I can see you're really tense and frustrated right now. And you can match their tone and their pace, because they might not have an awareness of how they're actually presenting, and how they're, and your tone and your pace can be so co-regulating for them that they can actually come out of that response and be able to move through it a lot quicker and a lot more effectively. And finding a quiet space in your clinic, whether that if you're in a busy waiting room and there's lots of people around, it's not necessarily the best time to have a gentle conversation or a delicate conversation. And so trying to find a quiet space can actually de-escalate the situation as well, because people will feel more safe and more contained, less vulnerable and less put on the spot. So therefore, less aware of how they're presenting it to others, and less conscious of that, but more able to focus on you and what you're saying, and your gentle nature and your gentle tone and your matching and your pacing. So your very interaction with them can co-regulate them enough to be able to move on and move out.
Absolutely. Thank you, Catherine. They're all really important points. Okay, so now we're going to take a break. So we're going to aim for a 5-minute break. So if we meet back here at 2:17, and yeah, we'll continue then. Thank you. Okay, so now we're just going to look at compassion fatigue and burnout. So all of these types of experiences that we've been hearing about can lead to compassion fatigue and burnout. What we want you to do is just to brainstorm some ideas of the signs and symptoms of compassion fatigue and burnout. So as you are thinking about this, just bear in mind our earlier discussions when we were exploring thoughts, feelings, sensations, and behaviours. So I invite you to either unmute yourself or just to type in the chat box.
Things that you used to enjoy no longer bring you joy.
Yeah, Jen, that's a really good point. Absolutely. So sort of that withdrawal from what you typically enjoy.
One that I've noticed as a coping mechanism can sometimes be taking things too far in like a joking sense. Things that would normally be sensitive can be taken into very crude jokes, which like I know there is a level of keeping things light, but I have noticed in certain people who aren't vets but do have quite taxing jobs, when they talk about certain topics, they can be very callous and insensitive in what they say, even in times when they are bothered by it.
Thanks for sharing, Megan. Yeah, that's a really good one. We've got some responses coming into the chat as well. So Lee, yeah, turning into a big emotionless ball of not caring about anything. Yeah, and that's great that you can recognize that in yourself. Caitlin, becoming cynical. Yeah, a lack of motivation. Absolutely. Becoming an amorphous amoeba on the couch. Love that. Fixating on comfort. Yeah. And that's definitely there's quite a range of things coming out here, and that's where it will differ for everyone. What I quite often like to talk about is sort of that dark side of the of the personality might potentially come out in times where we are stressed, when we're tired, even when we're bored. So some of these things you're describing definitely is in line with that.
There's just a few more things in the chat that are coming through. Thank you for your contributions. Things like inability to deal with anything else on top of what's going on already. So your cup is full and you have no capacity to let anything else in. You're overflowing, and it's having an impact on you and everyone else. Diverting and playing binge video games and ignoring life responsibilities is another one for sure. And that's what we were alluding to on comfort behaviors like binging on Netflix and things like that. It's avoidance, right? Pushing down, distracting yourself from the feelings. And the extreme side end of things, yes, when there's a substantial pushing of feelings or a history of emotional dysregulation or things not going so well, feeling suicidal can come up when you are so burnt out and haven't been able to deal with it properly. Not being able to cope with minor inconveniences, very emotional, yes. So the thing there, I think, Shoshana, is that, you would notice if someone has a pretty high tolerance for dealing with things and then all of a sudden can't, you're noticing a big change. And that's a big thing with compassion fatigue and burnout, is that you're actually noticing changes to the way you're responding, changes to your physiological responses, your emotional responses, and just how you are in the world. That's an important one to note. Just less extreme than that is feeling of just wanting to stop, not wanting to exist, not wanting to die, just not wanting to just take it all away. Yeah, take it all away. I can't do anymore. Yeah, Jan, I hear ya. And Katie's just seconding that. So you guys are on the right track there with those examples. And it can be more subtle, but with such highly functioning and highly achieving people in your groups, you notice things like changes. You notice when there's a slight change in character, and you can start seeing those things build up. And those are the signs. Those are the signs: changes, irritability, avoidance, all those things that you listed.
Yeah, and sometimes these are referred to as red flags. So being aware of what your red flags are really important when you might be experiencing fatigue, and if we can be doing things sort of on a day-to-day basis to try and bring ourselves back to that baseline, so that we don't go into that point of exhaustion and potential burnout. It's really important. So we're going to be talking about that shortly. Move on to the next slide.
Right. So compassion fatigue, we've been alluding to this lots throughout the presentation, but compassion fatigue, it doesn't just come out of nowhere, right? So like I was saying before, in such a successful, highly committed, passionate, hardworking group of people who want to make a difference, you pour out. You pour out to others. You pour out to your clients. You pour out to the animals. Your problems occur. You work harder. You don't just put yourself in, first and say, sometimes people have really good boundaries around this, but with compassion fatigue, often the case is that if there's a problem, we just want to give more, do more, work harder, increase our hours, be there longer, work hard physically and do more paperwork to get this solution to come. So we pour and pour and pour, and then all of a sudden we haven't taken care of ourselves, and there's been little or no impact. So our satisfaction from that experience starts to dwindle. And then we have potentially go into maybe some sort of grief cycle response where we're actually maybe a little bit resentful or angry about the situation because we've denied, our capacity to recognize what's going on and deal with it. And like that disenfranchised grief we talked about, we maybe have a lack of institutional support. And so with this, all you're pouring in and you're pouring out of yourself and into others, you don't have the recognition. It's just expected. And then we can become disillusioned. We can become disillusioned from our job, from our families, from our life, because we haven't been pouring into ourselves. We've been pouring to everyone else. And then we withdraw. We start becoming a little bit bitter, cynical. We start maybe overcompensating with maladaptive coping strategies. Maybe we're self-medicating now. Maybe we're, completely isolating ourselves, or we're just not ourselves, and we end up being burnt out. So compassion fatigue, again, I just reinforce, it doesn't happen out of nowhere. There's a build up that happens. And when we recognize this cycle can occur, and it's again, like Em alluded to before, when we recognize and we're self-aware, we can recognize that this is compassion fatigue. You know your typical patterns, your typical person that will pour out more and more and more. How do we work with this? Well, we become aware of our boundaries. We become firmer with our boundaries. We go into our next phase of our career or our stage of our learning with clearer boundaries. Because when you can't take care of yourself, it's hard to take care of others, and it's hard to take care of the animals. So it's really, really important to take care of yourself. So I just see Katie has a hand up. Oh, gotcha. Hands up. Who's in the burnout box? Okay. Gotcha. Does anyone want to tell me a little bit about that at this point?
Oh, you go, Jen.
Oh, okay. I'm in vet school. I feel you're shoved into burnout really early on, and then you're just pushed harder and harder and harder, and there's no way you can actually keep up with everything. There's no way to have you can't implement. You don't have the headspace to, well, I find I don't have the headspace to implement a lot of really proactive, what's the word I'm looking for?
Self-care?
Not self-care, coping mechanisms. So proper and proactive coping mechanisms, which you'd call self-care, that I find really quite difficult to implement. And so I fall back on my normal coping mechanisms, which are listening to serial killer podcasts, because it tells me that there's worse things in the world, and there is a process of evil person does evil deed, good people go and get evil person gets put away. So there's a sense of law and order to the world, where there is absolutely zero sense of law and order to vet school and my life, because it starts out painful and it never lets up. The running joke is, if you didn't start vet school with anxiety and depression, you sure as shit will be leaving it with it.
I'm so sorry to hear that. Thanks for your vulnerability, Jen. It's a really, really tough one. So you get into the situation where you're pushed and pushed and pushed, and you haven't had lots of chats when you start in orientation, first year, second year, about the disenfranchised grief that you're going through, this lack of recognition of what lies ahead and what journey you're on, this lack of recognition of the push that you put through, which tells me that maybe, that lack of institutional support, the collegial support, is something to be advocated for. My guess is that you know each other and you have developed some sort of peer network within your cohorts to be able to get through this, because you can relate and you can, and you're here, Jen. So what is it what is it that sticks you here? What sets you beyond the others who couldn't do it?
Sheer bloody-minded stubbornness.
Okay, there's something to be said for that. My word for it is resilience. But a lot of you are in this boat. A lot of you have really validated each other, and there's something in that. Okay, there's something in the fact that you're all here, and that there's a shared common response here, and that you've validated each other. So part of that is resilience. Part of this is peer support. So I don't have an easy answer for that one. All I know is that today you're recognizing hard that you're on this compassion fatigue cycle, that you guys are identifying that you're at burnout. And so I just want to push a little pause here, and just say, look, when you are at that burnout stage, you're becoming more cynical, you're becoming depressed, you're becoming withdrawn, or you already are. You've identified that. So I really want you to take in the fact that you can do something about this, and that is to reach out to our support services. You can reach out to the student care team. You pay for health and counseling in your student levy. You may as well use it, because we've got trained experts who deal with compassion fatigue and burnout, who can provide counseling and support, maybe just to take the edge off while you finish up your vet schooling and you go off into your career. So do know where you can get those. Those services are on MyHub. Also drugs. I had alluded to self-medication there, but Jen just named it. Drugs. I hope that's not the case, Jen, but if you need help, see your GP. There's no shame or harm in that. If you need help, it shouldn't get to this place where you're feeling pushed this far. So look at it from a collegial perspective. Do you have good enough supervision? And if you don't, seek it. Empower yourself to do that, because you are entitled to it and you deserve it. Seek the supports through the university. We're here and we help students in this situation all the time. Or we can refer you on to the counseling team. We've got self-help options online. So contact Em and I after this if you need more help and need more information and support on this.
Yeah, awesome.
Sorry, Catherine, can I just ask a question?
Please.
This is the first time I've heard about the student support services. I've always just gone straight to the counselling department and the Massey Health Centre. Is the student support services different?
So health and counselling are part of our student support services, but the student care team, like Em and I, we work on an individual basis on what it is that you're looking for. And if it is counseling that you're needing because you're having a grief response and you need some time to process that, we will refer you to health and counseling. But we're a first point of contact, and we're the person that's going to follow it up and make sure that it's followed through. So if you do come through us before you go to health and counseling, we're going to make sure that you've had an appointment, that you're feeling okay about it, that you've got everything you need, and we're going to check in with you and be kind of like your support person along your journey.
Okay, cool. Thank you.
Yeah, no problem, Katie. Thanks for the question. Got some chat
Yeah.
here.
I just want to reiterate that there's no shame in reaching out for help here. We want to try and like our team, we very much work in quite a preventative way. So we sort of sit between the self-help and counselling team. And so a lot of our work that we do, and we'll go into this in further depth soon, is about trying to, once we notice these red flags, acting on them straight away. So, okay, I'm noticing that I'm getting more irritable. Okay, I need to perhaps put some more self-care systems in place so that we don't get more sort of into that orange, that red zone where we're feeling fatigued and exhausted and potential experience potential burnout. And yeah, thank you so much to those who have shared their personal view on this, and just know that you're not alone, and clearly from the chat we can see that you're all in this kind of similar boat here, and and this is part of peer-to-peer support, and we are here as well as a student care team, and we'll go into this a bit more soon. Okay, so now we're going to talk about prevention. So we are going to look at a few different things within our breakout rooms again. So looking at prevention of compassion fatigue and burnout. What could be done once we know that this is a problem? Where can we find guidance, support, and ideas? And what are the barriers to doing these things? So again, we're going to go into breakout rooms and discuss these things together. I'm just going to post all of this in our chat.
I can do it as a message to all if you want, Em.
Oh, perfect.
If we can go back to that slide.
Yep.
Awesome, thank you. So what could be done once we know this is a problem?
Therapy.
Therapy is an idea, yeah. So therapy is
clinic managers.
Pardon me, Kiana?
I'd say talking to the other people at the clinic and like your manager, and just making them aware that this is what's going on.
Mm-hmm. Tough thing to do, hey.
Yeah, but I think it would really help, and maybe then they won't load you up so more in the next few weeks while you're trying to recover.
Yeah, so look at job responsibilities and divvy them out differently. Yeah,
and kind of being like brave enough to say, I can't keep up with what you're giving me as well. Just at this moment, it's just a bit much, and I need a little bit taken off my plate.
Vulnerability.
And boundaries as well.
Boundaries.
Yeah.
on what Kiana's saying, I also think that when you tell your practice manager or your colleagues what's going on, that can also allow for them to be more compassionate. Like if your behavior changes, they're not just going, oh, what the heck is this person doing? They're being arrogant or they're being XYZ for absolutely no reason out of the blue. They can understand that something is going on. And even if they need to call you out on it, they can do it with an understanding of why.
Great, Megan. They can stop making it about them and they can depersonalize it and they can understand then and take their defenses down, like you said. Good one. Mm-hmm.
On that note of like talking to staff, I think it's also would be important to start making relationships with your colleagues so that when they notice changes in you, they can tell you if you haven't noticed yourself.
Mm-hmm. Yeah, so collegial support.
Yeah.
Support. And then you in turn recognizing it in them and having open discussion is about, hey, I've noticed, if we notice things in each other, can we tell each other?
Yeah.
Yep. Openness, transparency, it's good.
Yeah, and that's a really good way to build up our own self-awareness of what's going on. Often others can see it before we can even notice it in ourselves.
Absolutely. And where can we find guidance, support, other ideas and options? You've kind of alluded to this already, in a way.
That was actually one of my big questions I wanted to ask at the end of the session. In vet school, it's pretty clear where we can get help easily and quickly. You know, we have that on Vet Zoo, there is that emergency helpline we can call, and then there's the on-campus counsellors and you guys. But when we get out into practice, every sort of support network that I know of is a little bit intangible almost, like you know, the Riptide Project on Facebook, where it's not really a support network as such, it's more just people sharing their stories and not getting any personalized support. So where can we go for more personalized support once we get into practice if our own clinics aren't sort of providing us with everything that we need? Does that make sense?
Yeah, that's a good question, Katie. And I don't know like all of the ins and outs of vet schools and vet practices and connections and things like that. So the thing that comes to mind is your registration body. So if you had like a registration body to reach out to, and I'm guessing on their, and potentially on their website or within their scope of practice, they may have ideas for you around that. They may have networks to connect in with. I don't know. Have you thought about that, and have you used that as an avenue or a pathway?
I don't know if NZVA provides anything like that, but I will have a look.
I think they probably have the most up-to-date and accurate information. The other thing is that internationally, there could potentially be some support groups or associations to be part of where this is talked about. So it's worth putting in some research, because I personally don't know. But you know, if we're looking at wider issues faced within vet practice and debriefing these and working through them and that sort of thing, I would definitely look locally and wider, nationally and wider internationally, to see what exists, because I'm almost certain there must be support. So you've mentioned counseling, you mentioned student care, we've got chaplains, and we're going to go all into this, and we've also got this you know, an app called Talk Campus, which is another option that's kind of an online well-being support 24 hours a day, 7 days a week, which is, you know, can be anonymous, and it's well-trained professionals that are on there to support people. But I think you're looking, Katie, more at specialized vet support, clinical support, and emotional support.
Yeah, that's right.
Okay.
Yeah, that's something I'm not sure about either, Katie, and that's something that it's great that you're being so proactive and forward thinking in that sense, and already looking at the longer term support that you can access as a vet. And yeah, there's some ideas that we can talk about that are more general kind of support, which aren't limited to Massey, that we can talk about soon too. We might link on to the last question now, and if anyone has any ideas that came up from their discussion in the groups, what are the barriers to doing these things?
I discussed a barrier, probably waffled on a bit about it, but for me personally, one of my barriers would be like I could recognize when I'm burnt out and when I've put too much on my plate, but I'm worried about being perceived, especially, you know, once I graduate, going into practice, as being someone who isn't committed or is lazy, and then subsequently, I guess it's that spiraling thought, subsequently missing out on opportunities or creating poor relationships with senior staff. I think that's something that is quite scary as a thought, which would prevent me from doing healthy behaviors like putting in those boundaries, as opposed to just continuing to burn myself out because I want to achieve as much as possible, and you know, in the shortest amount of time as possible.
Yeah, and what you described there, Megan, that's absolutely a part of that sort of tall poppy syndrome that I think a lot of New Zealanders have to, and it's a big society problem that we do have. And yeah, and I think we often over exaggerate the negative qualities that we have, right? Like we're hardwired as humans to seek out that negative, and you know, often we can be very self-critical. And I know, like, as being vet students, a lot of us, we will be perfectionists, we will be very hardworking with that A-type personality where we want to do everything right. And I think it's about recognizing like boundaries are so healthy in supporting our own mental health and well-being. And if we can't fill up our own cup first, how are we meant to support those around us and support our patients and clients as well? So thank you for your comment there, Megan.
Also external pressures. So Megan spoke about internal pressures, but we've also got internalized external pressures and external pressures. So there's an expectation from, for example, in vet school, there's an expectation from the staff that we simply do it, when it's not necessarily possible without just burning yourself out. And I think there's a problem where, I know I certainly did in my first few years, I internalized that external expectation, and so I applied even more pressure on myself. I didn't require the constant external pressure because I had internalized it, and that had become my existence.
Yeah, absolutely, Jen. Thank you for sharing that. And yeah, and that's great that you can recognize that that pressure can be external as well as internal. And I think that's where you know, like the academic staff at Massey, they like we're all obligated as staff members to kind of have that sort of wellness lens and well-being lens towards the students who we're working with. And you know, as much pressure as I can imagine they would place upon you, I'm sure there would be some degree of compassion and understanding, you know, if you did need an extension or you know, that kind of thing. What are your thoughts, Catherine?
I've been busy in the background trying to look up some information for vets needing support. So I haven't really been paying too much attention. I'm sorry. What was the question? What was the question, Em?
It was just around, Jen was just mentioning how like she's sort of facing that external pressure, like with academics and having that sort of pressure placed upon as well, and that could be a barrier to sort of seeking support.
Is the academic pressures and not having enough time? Is that what you're?
It's more that you simply, there's the expectation that you simply suck it up and do it.
Yeah. Yes, unfortunately, that sounds like the reality, and that sounds like the reality in some of the colleges that we've been working with, and it like there is no easy answer in that regard, and there's no sort of any solution that I've kind of come up with and that I've ever heard about. And so the only thing that Em and I suppose have on offer is just, let's talk about it. Let's see what we can do to problem solve some of this stuff, and let's see what we can do to process some of the emotion behind it. And unfortunately, some of these pressures are unavoidable because of the condensed version. And I'm not going to say your name right, but Aodan Wildbohr has made a point that in vet school you're condensed. This academic timeline is really condensed, and you need to get it over within a certain time period if you're studying in this way. And then when you go into the workforce, you can look at other ways of working, flexible work hours, working part-time, for instance, and these sorts of things. Now, not an option for everyone, and everyone's going to have a personal opinion or preference about it. But these are the things that we, I suppose, have some control over when we get out of vet school. It's like dangling a carrot at the end, I suppose, but it's the only answer I have at the moment. And I'm really hearing you. I'm hearing you all. And what I'm hearing come through is that this is a really pressurized program, and that you guys are all under such pressure. And I feel for you. My heart goes out to you, because it's like, I want to take away this pressure for you, but I really don't have any easy answer, except the fact that you're here and you're still in vet school shows me that you've got extreme resilience, and you've got through this somehow, and that you've gone on that compassion fatigue, and you're identifying that you've got burnout. So reach out. Get in touch with your course coordinators. If that's too hard, get in touch with us, and we'll help you get in touch with your course coordinators to let them know where you're at, so that we can try and find a solution to this, or a resolution of some sort. And we will help. We are here to support you and back you. We can't take away the pressures, but we are here to hopefully ease some of that burden in your mind for you. So do reach out. Thank you, Aiden. Gotcha. Irish spelling, right? Gotcha. I'm becoming more culturized as we go. Thank you.
Okay.
And
so we might move on to the next slide. And we're now going to spend a little bit of time talking about self-care. And Catherine, I'm very conscious that you're going to have to leave us quite shortly, so that's absolutely fine. You just shoot off when you need to.
Pleasure. I've enjoyed being here with you, but I'm going to leave it to Em. But I will hear from you if you need to be in touch. Do not hesitate.
Thanks, Catherine. All right, so we're just going to think about our self-care now. And often this can be something that comes last for us. And I know for me, when I was a student, I'm not a vet student, obviously, but I did do post-grad study, and you do find at times that your self-care gets pushed to the bottom of the pile, as you've got your assignments, your practical work, your tests and essays, whatever that you're doing. You find that you're sort of juggling so much with uni that you put the self-care to the bottom. And what I really want to encourage all of you is that if you take one thing away from this session, I think that self-care really needs to be higher up the list. And of course, it's not going to happen overnight, but hopefully we can look at some sort of strategies, some tools that you can put in your toolbox to help with self-care. And just before we do that, I just want to quickly talk about control versus influence. So from what you've been describing to me during this workshop, there's a lot of things that are perhaps out of your control. So, things like, how much workload that you might have, for example, the high degree of workload. But there are a lot of things that we can influence to sort of deal with these things that we can't necessarily control. So we have a sphere of control, which is quite small, right? So we've got like the circle. And then we also have a sphere of influence. So the sphere of influence is a lot bigger. And self-care is something that we can put, in place to, we are directly in control when we have these self-care practices, and therefore we're in a better position to influence these things that we cannot control. So hopefully that just gives a little bit of context as to why it's so important. And I think that time can often be a big barrier for not doing self-care. And I just want to sort of say that even if we just dedicate 5 minutes in the morning and 5 minutes in the evening to self-care, like that can go a long way just to kind of get us started, to get the ball rolling. I could go on and on about this, but I'll try and stay on track. So we're just going to take a few minutes to come up with a couple of solid and achievable self-care points using this model. So this kind of goes back to those red flags and those things that we discussed earlier in the workshop around noticing, how we react under that stress and under that pressure. So we've just got a little bit of like filling in the gaps exercise to do. So I'll just talk first. So when I get brain fog, then I'm going to do this. When my mind starts telling me that I'm not good enough, for example, then I need. So what do you need when that happens? When my body begins, so you might notice that I'm fidgeting with my hands, then I need to do this. When emotions begin to become overwhelming, for example, then I need to. When I notice I'm behaving like I'm really snappy, then I need to. So I'm just going to give you a couple of minutes just to fill in the gaps here with this little model. And just sort of think about what is relatable for you. So what thoughts start coming through? What happens to your body? What emotions might begin to come through when you're noticing this fatigue or stress? It's a murder podcast. Oh, yeah, you've talked about that a while ago, Jen. And that can be a really good sort of distraction technique for us, just to kind of zone out what's going on. Sniffing cats. Love it. Of course, these are all animal related. Love it. Guinea pig cuddles. That's so nice, Kiana. And these are also very therapeutic things, Therapy quail, nice. Bad jokes, yeah, absolutely, yeah. Hot coffee in the shower, that's a really good one, Lee. Reading the Bible, praying. Yeah, absolutely. So tapping into our spiritual well-being. Cleaning my room. Yeah, that can be a really nice one. Yeah, because if we've got a clean, tidy space, it can actually help declutter your mind as well. A good nap. Yeah, absolutely. Yeah. No, that's great. Loving these self-care strategies, guys. Some really good ideas here. Awesome. Taking care of your parent. Yeah. Oh, that's so cool. Nice. Okay, so we'll move on to the next slides. Okay, so this is where we're just going to talk about the different support services and options available at Massey, and then we're going to look at some more external support options as well. So my hub is currently being updated at the moment in terms of the wellbeing content. So we do have quite a few sort of self-help resources on my hub, so you just have to log in and then click on the wellbeing tab, and we've got a whole lot of stuff. Most of it is in the COVID-19 tab. That's sort of all the most up-to-date stuff. So we've got like meditations on there. I've think got a couple of yin yoga sessions there as well, and yeah, I'll also mention now that we have a Facebook page for wellbeing. So it's Massey Manawatu Wellbeing. So if you're on Facebook, definitely check that out. And I'll write that in the chat as well. We've got our student care team. So that's who Catherine and I are a part of. So this comprises of about 10 of us wellbeing advisors across the 3 campuses, and also supporting distance students as well. So we've got both domestic wellbeing advisors and then international wellbeing advisors as well. So a part of our role is, a lot of it is doing workshops with students. So I often run a series of wellbeing workshops for each term. So we've just finished 4 on different topics like stress management, eating well on a student budget, things like that. We also have a more sort of proactive program that we have each year where we focus on about 5 different themes throughout the year. So our next one coming up is University Mental Health Day, which is I think week 2 of next term. So it's that first week in May. So we're going to have lots of things available, lots of events and different resources that we're going to be promoting. So definitely get involved in that. And my hub has an events tab as well, where you can see what is coming up and what the different events are. So that's where we upload a lot of that information. We've got our counselling service, which we've touched on as well. And I've just got the link in where you can sign up for counselling. And yeah, the counselling service, it is more sort of like a shorter term support where they can offer, you might just want to go and have one session just to sort of, you know, maybe just vent what's going on. You might have had a really stressful situation happen and you just want to sort of debrief with someone. And they're in a really good position to refer you on to external support for anything sort of specific that you are struggling with. And sort of, yeah, we work quite closely with the counselling team. And like I said earlier, we're more sort of the practical support side, looking at what's going on top of the surface. So looking at sort of, yeah, anything from diet to exercise to sleep, things like that. Catherine and I, we do see students on a one-on-one basis when required as well. So yeah, you can definitely email us on the email address, and we can link you in with the counselling service as well. And obviously all of our work is confidential, that we do with one-on-one students. We've got our student advocate service as well, and that's through MUSA at the Manawatu campus. So they have student advocates, so someone who can act as sort of a support person for you, and Catherine and I, we do a little bit of that work as well. If you make a complaint against someone or about something, then there is that support available. We've got our chaplaincy service. So on the Manawatu campus, we've got the centre, and they have some amazing programs that they offer. So every Tuesday they have a meditation group where you can go along and do meditation. Wednesday they've got an anxiety support group. They've just got a whole big space for you to go and study and use, make tea and coffee or chill out or whatever you need to do. And there's always someone there who's more than willing to have a chat. And even if you aren't sort of religious, so to speak, everyone is welcome and invited into this space. So it can be a really good support system there. Talk Campus is something that Catherine referred to earlier. So it's a peer-to-peer, basically a mental health platform. So you can go on there and it's basically looks like any social media does with like a news feed, and you can just sort of voice what you might be going through, what's going on. You basically create an anonymous profile where you can share as much or as little as you like on the platform, and there are trained professionals on there to sort of step in and provide support, as well as your peers, and often it's a really nice way to just go on and vent, and you just find out pretty quickly that you're not the only one going through something like that, or a lot of others can also relate to what you're going through and how they might have approached that particular situation. And they have some amazing wellbeing resources on there as well. So you just need to sign up through the App Store or Google Play with your Massey email to get it free. And I've just got here some other sort of more general resources that you might be interested in to support your wellbeing. I really like to recommend this mindfulness app, Smiling Mind, to students because A, it is free, and B, it is amazing because you can choose what sort of meditation or mindfulness you might be interested in. So say if you really struggle getting to sleep at night, they have special sleep meditations that you can do, or maybe you want to have a nice meditation as your study break or during your lunch break to try and refresh and focus and energize. So they've got lots of options on there. And then there's some more sort of general sort of websites that you can go on to. The lowdown is more if you're experiencing symptoms of depression. But yeah, there's some really good wee gems here. 5 Ways to Wellbeing, that just gives you a little bit of food for thought as to how you can boost your wellbeing. So by giving, being active, learning, connecting, and taking notice. And quite similar with a great dream over here as well. We've got the helpline number that you can call, as well as texting or ringing the 1737 for a trained counsellor, and that is 24/7 service. So now I'm just going to open up the floor for any questions or comments. If there's anything that we've talked about today that perhaps you want more clarity on or more information on, or if you sort of have any specific requests for future workshops, we'd really love to hear from you. What I am going to do is send an email out just with a little bit more sort of resources and information that you might find useful to support the content that we've talked about today. So do keep an eye out for that. So yeah, just if anyone is brave enough to ask any questions or to share any thoughts or reflections you might have, go for it.